I would like to introduce our next speaker, who is Dr. Lori Neeleman. So when I was talking to my family about this conference, and I said that we're going to have a sleep doctor come talk to us about how to improve sleep, everybody, my mom called my aunts, my sister, and everybody from my family wanted to come to hear Dr. Neeleman speak about sleep. So she is a licensed clinical psychologist with board certification in behavioral sleep medicine, which is, I think, what we all need. Her clinical practice is primarily focused on treating patients with insomnia and sleep disorders with cognitive behavioral interventions. She's happy to have the opportunity to talk to this group about sleep and effective interventions that can lead to improvement in sleep and overall functioning. So let's give a warm welcome to Dr. Lori Neeleman, who will now hopefully keep us all awake with some very interesting talking about sleep.
Thanks.
Yay!
All right, so can everybody hear me in the back? Is that going to be okay? My voice is kind of soft, so if we're good. Okay, so can I get an idea of who I'm talking with? Nurses, physicians, independent practitioners of some kind, mental health people. Okay, so what? Health educators. Okay, so I'll try to gear what I'm going to talk about just to fit, you know, what you guys are interested in. But I've been told that I'm a better presenter when I have interaction, you know. So I'm going to encourage you guys to ask questions as we go along. I'll try to remember to repeat the question so that everybody can hear it. Sometimes I forget, so if you want to remind me, that would be okay too. So I'm going to talk about sleep. This is what I do almost every day, is talk about sleep, and hopefully there will be some information that you'll be able to either take home or share with the people that you work with, okay? So I often will joke or, you know, talk to people about how vitamins often have their day, right, their day in the sun. So it was vitamin C, and then it was vitamin E, and more recently it's been vitamin D. And I think at this point is really, it's kind of sleep's day in the sun, right, or under the moon, however you want to look at that. So I don't think any of this will come as a surprise, because it's, you know, sleep is in the news. Sleep is, there are all kinds of studies going on talking about the benefits of sleep. Everything from helping to prevent Alzheimer's, to sports performance, to grades, to work performance, to overall health, mental health. So sleep, I think we'd be hard-pressed to find an area of health that sleep doesn't impact, okay? And good sleep impacts it favorably, and if you have poor quality sleep, it impacts it negatively. And this list is just a little bit longer than the favorable side, right? Because things like suicide increase, the risk of suicide increase significantly when people aren't sleeping well, especially if they're getting less than 6 hours of sleep. So if you're working with people and they're talking to you about that, just kind of tune in, right, to help protect their safety. Poor sleep impacts mental health, aside from suicide, so depression, increases the risk for PTSD, certainly impacts physical health, so really every area, right? And I don't think that's a big surprise. Anybody surprised? Not really, right? And that's a lot of reasons I hope that you guys are here, is because you recognize the importance, and so that's why we're talking about it. So what I hope to do is give you enough information about sleep itself that you have something to hang the recommendations on, okay? Because I think it's one thing to tell people, you know, well, you ought to do this, and you ought to do this, and you ought to do this, but if you don't really understand why, then a lot of that goes out the window. But if you understand why, then sometimes people are more likely to implement what you're talking to them about. So most of you have seen a slide like this or in a textbook, right? So these are the stages of sleep. It really kind of gives a summary of what sleep looks like through the night. And there's just a couple points I want to make. So one, we don't lay our head down and pass out, and we're gone for the rest of the night, and it's all this static thing, right? That's not what's happening actually at all. In fact, in some parts of sleep, the brain is as active or more active than when we're awake, and that tends to be more in REM sleep, which is these red lines, right? And that's like dream sleep. That's where we have our story dreams, usually. And then, so slow wave sleep, really important for physical repair. We need that slow wave sleep in order to really be healthy, to provide our bodies time to repair and restore and prepare for the next day. Now, a couple of things on this slide. One, I want you to notice that it's normal to wake up, okay? We all wake up once or twice during the night. When I'm treating people with insomnia, a lot of times they'll get kind of freaked out that they're waking up, right? Nobody wants to wake up, but we all do, and it's built into the cycle. So the key is to be able to roll over and go back to sleep and not to get too stressed about being awake. So when you're educating, helping people understand that can just take a lot of stress away, okay? The other thing is there's a difference between the first part of the night and the latter part of the night with regard to what's going on with the sleep staging. So in the first part of the night, you get more slow wave sleep. So this stage 3 sleep, physical repair. Toward the end of the night, you have more REM sleep, which is, again, the dreaming, but it's also what we think, anyway, is really important for things like memory, problem solving, that kind of stuff. So if you cut yourself off, right, so you know, if you get up at 5 and you didn't go to bed till 11, you're missing probably a lot of the REM sleep, and that's really important, right? Now, your body's pretty good at kind of increasing REM pressure, and it may try to make up. But the more that you can allow for sufficient sleep, the better you'll be able to go through all those stages, okay? Any questions? Okay. So this next slide, there are a couple of main drivers of sleep, right? And there's the circadian arousal drive, or the circadian rhythm, and then the homeostatic system, okay? So the circadian rhythm is really impacted by, you know, bright light and nighttime. It goes around a 24-hour cycle. There's lots of things that happen, and we'll talk a little bit about a little more about that. And then the homeostatic sleep drive essentially is the longer you're awake, the more likely you are to go to sleep. Okay? So if you nap during the day, then you only have like maybe 5 or 6 hours to have that sleep drive build. So it's harder to fall asleep at night usually if you take a long nap. So that's kind of the idea. Okay? So just to break this down a little bit more, this is the homeostatic sleep system, pretty basic graph. Again, in the morning after you've slept, your sleep drive or sleep pressure should be low, should be decreased, should be, you should be alert and awake at least about a half an hour after you wake up initially. You have a little time to kind of get going. And you can see that it increases through the day. If you don't go to bed, it continues to increase and eventually will give you a hard shove into sleep. But you know, hopefully we're sleeping at appropriate times and getting enough. And so it will raise to kind of an optimal point, then it will drop through the night, and then it will increase again. Now, part of what controls that is adenosine, right? So the breakdown of ATP. It attaches to receptors in your brain, and as the day goes on, you get more and more sleep pressure. Okay, part of why caffeine works is because it blocks those receptors. So if you block those receptors, you're not going to get sleepy, but there's still a lot of wear and tear on your body. So that's where the half-life of caffeine comes in and why we recommend about 8 hours between your last Diet Coke and when you're going to bed. Okay? Questions there? Okay, so this next slide is the circadian rhythm. Certainly this isn't all the players, and it's a super complex topic and interesting. So if any of you want to pursue it, you should, because there's all kinds of stuff going on. But essentially these, right here, so core body temperature, cortisol, and melatonin are some of the key players, right? During the night, core temperature drops, so it's a little bit lower. That tends to help us sleep more soundly. Plasma cortisol is lower in the night, hopefully. If it's not, you're going to have more trouble sleeping. And then, of course, melatonin is rising, okay? So a couple of things to point out here. One is melatonin starts to rise 2 to 3 hours before you ever go to bed, okay? So, probably most of you have heard a little bit about the screen time before bed and how that's disruptive. This is why, is because if you're on a screen, it's inhibiting that melatonin release. So you're more likely to not get sleepy, for one, but then also your sleep quality isn't as good. Okay, so we'll talk a little more about that as we go through. Any questions about that circadian rhythm? Yeah.
I'm thinking about the patients that work night shift.
Yeah.
So how to approach your messages to...
We're going to talk about that. Yeah, and and at the end, there's going to be plenty of time for questions, so we can talk more specifically about that. Okay. Other questions? Yeah. Ideally 2 hours, and that's hard. It's hard for people, especially, even TV, right? And our TVs are like 65 inches and on the wall. And so, but they do have what are called blue light blocking glasses, and they filter the light that's alerting to the brain. So you can wear those, and the research is pretty good. They've been shown to be effective. For your phones and your tablets, you know how a lot of them will have that night setting where you can flip on night shift or download an app that'll filter. Those don't work. I know, right? There was just a study like a couple months ago that came out and said it doesn't matter for melatonin. So it might have a little psychological impact, right? But as far as melatonin goes, it doesn't help. Okay.
The cortisol did I just cut someone off? The cortisol you're talking about, would that be related to stress?
Yeah. So cortisol ideally, right, is high, especially in the morning. So you can see that it starts to kind of peak actually fairly early, around 3 or 4, then reaches a peak in the morning and then decreases. And I don't know about you, but I often, the time that I roll over and go back to sleep is around 3 or 4. Lots of people wake up around that time, and it's probably, at least in part, due to that cortisol rise, because that's that kind of wakes the body up, gets you going. Okay, good. Other questions? Where? Yes.
So what do you think about supplemental melatonin?
Yeah.
For adults or children?
We're going to talk more about that, but just briefly, melatonin isn't a great sleep aid. Okay, it doesn't really put you to sleep, at least most people. If you do decide to use it, because it might help a little, I wouldn't go over 5 milligrams. 3 is probably, you're going to get your biggest bang, right? And when we're working on circadian stuff, actually a lower dose is better, and we'll get into more detail with that. Okay. Other thoughts, questions? Are you guys hearing the questions okay? Do you guys, okay, all right, good. Okay, so just back to this slide. We sleep the very best when these are lined up. So when the circadian rhythm has the arousal drive is down, the pressure for sleep is up. So melatonin, is kind of coming up. Your cortisol is down, like from that former slide. And then also our sleep drive, or our homeostatic sleep drive, is high, right? This is where we sleep the best. And if you can align things, most people won't have sleep problems unless they have, something like sleep apnea or something like that, okay? So questions there, you guys all kind of you have the anchor to hook it all into? Okay. All right, so common sleep problems. If you guys are educators and nurses, you're not gonna have someone come say, well, I have a circadian rhythm disorder that's delayed sleep phase type, They're gonna come to you and say, I can't sleep, right? Or I wake up all night long, or I wake up at 3 in the morning and I can't get back to sleep. And so this is where you can pay attention, and it will help to know where to refer, right? Because maybe it's insomnia, but maybe it's something else. And it could be lots of different things, right? So insomnia is one. Could be that circadian misalignment. We're going to talk more about that in a minute. Sleep apnea, lots of people don't want to even think about having sleep apnea, but it's out there and it's important, and you sleep better if it's treated, at least most people. So, being able to kind of have an ear tuned to that is helpful. And then, of course, mental health problems. So poor sleep is associated with depression, certainly bipolar in a manic phase, anxiety, so paying attention there. Be aware that sleep is often prodromal to things like depression. So it's not that you don't sleep well because you're depressed, right? They're their own kind of deals, and they're probably overlapping, but it's not, sleep doesn't improve just because your depression gets better, okay? And then, of course, substance abuse, and this could be caffeine, right? But it could also be other stimulants, things like that. Questions? Okay. Someone else might say, you know what? My whole family wants to go to bed at like 10, but that's my best time of night, right? That's when I have all my energy, I'm most creative, and so I do all my stuff, and then I can't go to sleep until 3. And unfortunately, I have to get up for work at 8, and so it's kind of a problem. Or you might hear someone say, gosh, at 7, I get home from work and I cannot stay awake, but then I wake up at 3 and I can't get back to sleep, right? So you've got these patterns that you can kind of listen for. This is where the shift work stuff comes in, because when people work at night and have to sleep during the day, that's way outside that circadian rhythm, and so shift work is kind of a risk factor for health issues, right? And so if you don't have to do it, don't do it, right, is one piece. But usually people will do better if they can align their rhythm and what they do to match their work, right? So if they have to work at night, they're going to be better staying up at night and sleeping during the day 7 days a week, which is hard to do, okay? So if you see these patterns, this is where that circadian rhythm disorder stuff comes in. This is treatable usually with melatonin and light, and we'll talk a little bit about how to do that. So this is just an example, and it's kind of what we were talking about. So for someone who's delayed, and this is our adolescence, most teenagers will experience some delay as they hit puberty, and then it goes until about age 25. So our early school start times are a disaster for our kids, but that's a whole other speech and soapbox. So you can see that when you're delayed, your melatonin isn't coming up until midnight, right? So you're not even getting sleepy until 12. And then you can't really fall asleep until 2. And then it's still high, at like 9 or 10 when you're supposed to be in class or you're supposed to be at work. So that's a problem. And then for these advanced folks, and this tends to be more the elderly, your rhythm tends to advance a little bit as you get older. And these are the folks who are having dinner at 5, and then they're going home to bed at 8. And it's because their melatonin is coming up around 6. They're tired, and they're going to go to sleep, and then they're going to wake up at 4 and be unhappy, usually. So, talking with them can be helpful too. Questions there?
It seems like my 4-year-old was delayed. Does it happen that early?
So not only is it affected by age, but it's also biology. So if you have anybody in your family who has kind of a delayed cycle, that may help explain. But it's also really heavily impacted by light exposure. So if they're on a screen at all, or the lights are bright in the house at night, that can impact it too. Okay, so another common sleep problem, I can't stay awake, right? So maybe I don't sleep well, but I can't stay awake during the day. Whenever I hear that, I always think about sleep apnea, because sleepiness is one of the biggest cues that it may be sleep apnea. But it could also be that it's just not enough sleep, right? So I met with bless his heart. So he was like 30, he's training to go climb this mountain. 14-day climb or something. And he comes into me and he says, I'm so sleepy. I can't stay awake during the day in these meetings. So we're going through all this long list. And what I should have asked first was, well, how long are you sleeping at night? And he said, well, I sleep about 6 hours. Not enough. He's a kid. Not a kid. He's 30. He's working out every day, doing intense training. You're going to be too sleepy if you don't get enough sleep. And really 7.5, 8 hours is about what most people need, okay? Other things are the circadian misalignment. You could have hypersomnia or narcolepsy, but that's pretty rare. Mental health problems, so especially depression or something in a bipolar spectrum, With bipolar, you have the manic phase where you really don't sleep, you don't need to sleep, you're doing everything that you ever wanted to do, right? But in a depressive phase, sleepiness is kind of a big deal, and you just don't want to get out of bed. So, and it's not just fatigue, it's actually sleepy. So you do want to just sleep all the time. So watching for that can be helpful. And then substances, opioids and benzodiazepines in particular. A lot of people will use these for sleep, sometimes prescribed and oftentimes not, but they'll use them. And that impacts your breathing during sleep. So it will actually increase sleepiness during the day.
So it kind of is like, it makes you sleep apnea.
Yeah, the opioids in particular, and it's central sleep apnea. So it's not that your airway closes, it's that your brain doesn't trigger the breath. So if you've ever had a bed partner who has these long pauses, and you're like kind of listening, like, okay, breathe already, that would be, but it's not noisy. That would be more like central sleep apnea. Other questions there? Okay. So another one, and this is, he or she snores, I can't sleep, they're not sleeping, or they don't know that they're snoring, right? And sleep apnea is going to be the most common cause, and again, treating it. It's associated with so many different health problems long term, and also just how you feel the next day. You feel kind of crappy if you've got moderate or severe sleep apnea and it's not treated. Okay. Everyone's kind of aware of the sleep apnea stuff, right? Okay. All right. And then another one that isn't very common, but it's actually more common than I thought. At least I'll hear a lot of people talk about it, is restless legs, where you get into bed or it becomes nighttime and you have to like move your legs, or you feel like you're going to kind of explode, right? This is often associated with low iron. So it's as simple as making sure that your iron levels are good, but it's a special measure. It's with ferritin, and you want to have it up above 50, okay, to 75, depending on who you talk to. So, but making sure that those levels are okay before you treat it with medication is a good idea. Okay, questions there? Okay, so what to do? If it's sleep apnea, noisy or quiet, talk to your doctor, because it's going to need some kind of treatment, okay? If it's restless legs, talk to your doctor. They'll do the lab work, and then they'll treat as necessary. If it's a circadian misalignment, you can treat that oftentimes behaviorally, right? The first is to try to align, well, here's my work schedule and here's my sleep schedule, and how do I make this match up, okay? That's hard to do in our society. I wake up at 5 because I have to do a bunch of stuff before I go to work, and that is way out of my rhythm. So I have what's called a dawn simulator, which is my alarm clock, and it kind of brightens and helps tell my body, look, really it's time to get up, even though you don't think it is. And it's helpful. Okay, and I can talk to you more about that if there are any questions. So align your schedule. Another is making sure that you're getting adequate outdoor light exposure. So the way we live our lives, right, we're in places like this during the day where the light is actually really dim compared to what our brains need. And then at night, we're like in these bright boxes of screens, and all the lights are on, and our brains just aren't equipped to function in a world like that. Okay, so the more outdoor light you can get during the day, wear your sunscreen, but let the light beam in, and that will help impact that rhythm. And then this is where that melatonin comes in. So if you're treating someone who's delayed, right, they have a delayed sleep phase, you can use 0.5 milligram of melatonin roughly 4 hours before bed, and it will help advance that rhythm, okay? So that's the general treatment, and it tends to be very helpful. And then making sure that you're getting enough light exposure, because you got to kind of have both, okay? Questions on that? Do I need to be more specific or clear? Okay. And then you could also talk with a sleep medicine provider. So most of these are, talk with your doctor. When it comes to circadian stuff, I would talk to a sleep medicine provider. Melatonin is a poorly understood animal out there. So I'll have patients come in who tell me, well, my doctor told me to take 10 to 20 milligrams of melatonin. And the trouble with that is when you take those high doses, it gets locked in, well, not locked in, but it gets in your system and it's still there in the morning. So then you could actually be more delayed the next night. So those higher doses sometimes can give you a harder shove into sleep, but it's probably not worth it, okay? You do better with being out in the sun. All right, hypersomnia, most important, making sure you're getting enough sleep. Treat sleep apnea if it's there. Lab work would include iron, vitamin D, thyroid, B12. Make sure you're getting enough light. So light not only impacts the circadian rhythm, but it also has an alerting kind of impact. So if you're walking into a meeting that is not going to be very exciting, if you can get outside before you do that, you'll have a better chance of staying awake, okay? Avoid substances, so things like benzodiazepines, opioids, the allergy medication like Benadryl, stuff like that, that can have a huge impact on your sleepiness the next day. It's better to avoid those as a sleep aid if you can. And there's lots of reasons for that, but that's a kind of a bigger topic. And then consider depression, and then talk with your doctor, right, if those things don't improve. So insomnia, and I'm going to spend the rest of the time really talking about insomnia, because this is the most common. About 10% of the population has an insomnia disorder, or primary insomnia disorder, but like 30 to 50 to 80%, depending on what you read, have trouble sleeping. Okay, so hopefully this will apply not only to the people that you work with, but maybe some of the people in here. All right, so treat other sleep disorders if they're there. Address circadian misalignment. So if you've got a delay, address it, and you may just sleep better, okay? Address perpetuating factors. We're going to talk about that a lot in a minute. And then hyperarousal. There is pretty good evidence that the hyperarousal model of insomnia holds true. So people with insomnia just run a little faster. Their sympathetic nervous system is a little more active. So helping them address that can be helpful too. And then address mental health concerns if they're there. Okay? So if you have insomnia due to sleep apnea, and I just throw this up because this happens a lot. If you've got someone saying, look, I wake up all night long, I can't stay awake during the day. My bed partner says I snore, but I don't snore, right? If you've got someone saying that, you want to consider sleep apnea. It's probably not just insomnia, okay? Not just insomnia, but it's the combination, especially if they've got low energy and they're falling asleep during the day. So people with insomnia don't tend to be sleepy during the day, and that's partly due to that hyperarousal stuff. Okay, so if it's insomnia due to circadian misalignment, again, fix the alignment. A lot of people will go to the doctor, and with the very best intentions, the doctor will give them a sleep aid. But if it's due to a circadian misalignment, the sleep aid will work for about 2 weeks, maybe a week, maybe a night, and then it's not going to work anymore because it's not addressing the right thing. So if you've got people coming in, at least now you can be kind of attuned to what they're saying and refer as appropriate. Okay? Again, adolescents. Anybody have teenagers in the room? Okay, so I used to cavalierly talk about this, like, well, just set limits with your kid and make him get off a screen and like do all this stuff. And now I have a 15-year-old, and I will never be cavalier again because it is really hard. They are completely tied into their screens, and getting them to understand that turning it off an hour or two before and getting light exposure, all those kind of things is really challenging. So partly education, but be aware that when teenagers, when they were falling asleep at 8 as a 9-year-old, and then suddenly they can't fall asleep until 12 or 1, part of that is a natural delay, but there are also behavioral things you can do to make it better. Okay. Questions there? Do I need to say more about that? Okay.
I have a question.
Yes, ma'am.
At what age-ish do you recommend that kids don't take naps anymore?
It depends on the kid. if the kid needs a nap, they should take a nap. And so there isn't a great age to just say, no more naps. Because some people will really need a nap until they're 6 or 7, and others will be done at 3. So you could give them rest time, kind of settle down time, right? And if their body pulls for the sleep, they'll sleep. If it doesn't, then you kind of know, I guess, nap times, we're done. Okay? Other thoughts, questions? Okay, so if you're working with someone with insomnia, and this could be, kind of a not quite insomnia disorder, but having a lot of trouble sleeping in general, and it's not due to something else, these are really what you want to focus on. So the Spielman 3P model, we'll talk about that in the very next slide, and then hyperarousal, circadian influence, and mental health. Okay, so here's the model. We all come with like predisposing factors for insomnia, right? And this could be due to childhood trauma, or just attachment style, or temperament, or biology. So we come with this piece. Some of us are more likely to get insomnia and others aren't, okay? And treatment for insomnia doesn't usually have a lot to do with that, at least from a cognitive behavioral perspective. And then a lot of times, or usually, insomnia is precipitated by something. So it doesn't have to be like this big event, right? It could be, it could be a traumatic event, and that will make it so that we don't sleep very well. But it could also just kind of build, a stressful job. Maybe you're outside your circadian rhythm, and so then you can't sleep, and so then you get stressed about it, right? So usually there's like this precipitating factor, precipitating event. But it's really these perpetuating behaviors that keep insomnia going, okay? Because our brains, if you think about our brains when we were living in caves, we weren't very well equipped to sleep when we were stressed, right? Because we would have been eaten by the tiger at the mouth of the cave. So that's an adaptive thing that's stuck with us over time. But now when we're worried about things like just sleep itself, right? Or the meeting the next day, or your kiddo, that something happened, you can't do a lot about that, but it still impacts your sleep, right? So again, that's where that precipitating stuff comes in, but the perpetuating stuff is things like safety behaviors, right? So, well, it takes me 2 hours to go to sleep, so I'm going to go to bed at 8 so that I can be asleep by 10, but then I'm not asleep till 1 because I'm so stressed about not falling asleep, right? So these safety behaviors tend to backfire, but a lot of people do them, and it kind of makes sense, but ends up making their sleep worse, okay? Another is worry about sleep, or making sure that everything is absolutely perfect, right? I gotta have the right pillow and the right bed, and I've gotta have my right white noise, and it's gotta be totally dark and totally silent, and I better have my mask, and I need to go to bed right at 11, otherwise I won't sleep. So it's this excessive focus on sleep, and that just tends to increase sleep anxiety and make it harder to sleep, okay? Sleep is as important as eating and drinking. Your body doesn't forget how to do it as long as you allow the process to happen. Okay, spending time awake in bed. So here, this is probably the most common. Well, I can't really sleep, but at least I can just lay there resting. I can lay in bed for 6 hours resting. And the trouble with that is that it interferes with that bed-sleep association, right? Because you really want the bed to be like a cue for sleep. Like Pavlov's dog, right? So you have the bell and the dog would drool, right? You want the bed to be the bell and the sleep to be the drool. So just the automatic response of going to bed, okay? But when you lay there awake all the time, that's not going to happen, and that pairing won't happen. And then arranging your day around sleep, or not arranging your day, right? So for a lot of folks who have trouble sleeping for a long time, they'll stop making plans. It's like, well, I don't know if I'm going to sleep, and I don't know if I'm going to be too tired, so I better not go to lunch, right? Or I better not do too much because then I'm going to be too tired. But that tends to interfere too, partly because quality of life goes down, right? But also because then you're in your home, you're resting, it's probably dim, you're not doing the things that are going to help your sleep anyway. Too tired to exercise, same kind of thing. Hyperarousal conditioned with going to bed. So a lot of people will start to worry. You know, it's like 5 p.m. or 6 p.m. or 7 p.m. and they can feel themselves starting to worry about going to sleep. What's going to happen tonight? Am I going to be able to sleep? Right? And then they go to bed and they can't. And so you get, rather than a conditioned sleep response to go into bed, you get this hyperarousal response. So all of a sudden your mind is going crazy. You know, it's noisy, you're worried, you can't fall asleep, and then that just strengthens that relationship. Okay? Questions on any of that stuff? Okay, so the last one is napping, and that's with regard to that sleep drive stuff, right? So if you take a 2-hour nap in the afternoon from, 2 to 4, then you only have about 5 hours for that sleep drive to build, and that's not going to be enough.
But
Yeah.
what if then you drink a bottle of wine, so you're super tired?
So we're going to talk about sleep hygiene, but the thing about wine is it'll put you to sleep for sure, but then your sleep is going to be horrific the rest of the night. So we'll talk about it. Yes, ma'am.
I'm not spending time awake in bed, so I'm not a TV watcher, but I'm a book reader.
Yeah.
So I to wind down at night, I'll climb into my bed because it's my way to get away from the
Yep.
TV and all that. And read, is that a bad thing then? Because I'm doing it in bed, should I
Yeah.
find another place in my house to do it?
Yeah, so it's a great question. So here's the thing. If you're sleeping well, I would keep doing what you're doing and just let it be. In general, you don't want to spend more than about 20 minutes in bed awake because that will start to reduce that association. But if you're sleeping well, don't try to mess with something that ain't broke, right? So does that answer your question?
Yeah.
Okay.
As for me, I just thought, I'm getting away from my kids
Yeah.
from the TV, and I'm getting into a quiet place to help wind down so I'll sleep well at night. But I'm actually then doing something that's opposite, possibly.
Possibly. So part of that recommendation is also so that you don't lie there worrying in bed. So if you're going to bed and you're totally relaxed and you're reading a good book and then you turn off the light and you go to sleep, that's probably a great wind down type of deal. Okay. Other questions? Anything? Okay. All right. So cognitive behavioral therapy for insomnia. How many people have heard of it? Wait, could you raise your hands like really high? Okay. So I did a talk with some residents up at the U, and I asked that same question, and nobody raised their hand. Okay, so at least in here, I think there were 3 people, maybe 4 people, and there's going to come a day when I ask that question, and like 80% of the people are going to raise their hand, but that's not yet. So here's the thing. Cognitive behavioral therapy for insomnia is a super specific treatment. It's super effective. 80% of people improve. They maintain their improvements, but there aren't enough providers out there that are doing it. Okay, so it's really hard to find a CBTI provider. But it is the recommendation. So the American Academy of Sleep Medicine, the American Physicians College, I mean, they're all, this is the first line treatment. So if ever you go to the doc and they want to immediately give you a medication for sleep, say, well, I heard about this. What about this? And the doctor will say, well, I don't know about that, but you could look it up and find a provider in your area, okay? So essentially, it targets the perpetuating factors. It tries to strengthen that bed-sleep association, so you're only sleeping in bed, and you're only sleeping in bed, so you're not sleeping on the couch. And when you're in bed, you're only sleeping, okay? It does address sleep hygiene, although sleep hygiene is generally not enough by itself, but for some people, it can improve their sleep. You want to have a consistent wake schedule. There are a few recommendations that I give where people look at me like, yeah, right, and that's one of them. People like to sleep in on the weekends, but if you can keep your rhythm tighter, so you can keep that wake time really generally within an hour, you're going to sleep better, you're going to fall asleep better, okay? 90 minutes, so when you start to have a greater than 2-hour difference, you see all kinds of changes in the brain, reward processing changes. It kind of creates a mess, and this is really important for our kids because they're getting up too early for school, and so they're sleeping until 1. So then on the weekends, so then they have these huge differences, and it's associated with substance abuse and all kinds of stuff. Okay, so keep your wake time the same. One of the most powerful parts of it is what we call sleep compression. So remember how I talked about like the safety behaviors, you go to bed at 8 so you could fall asleep by 10, and then you get up at 8 so you're in bed for like 12 hours, right? That would be the opposite of sleep compression. So essentially what we would do is we would shrink the time in bed closer to what you're actually sleeping, and that will drive up that sleep pressure. So then the pressure can give you a harder shove into sleep. Okay, and we do that for a little while, and then we stretch it back out so that you're getting the sleep we need, or the sleep you need. And that's probably one of the most powerful parts because it relies on sleep physiology. Questions about that? No? Okay. Let's see. So sleep hygiene, we'll talk more about that. And then also these beliefs, right? We all have beliefs about stuff. And with sleep, people develop pretty, what's the word? Hardcore beliefs about what they believe, right? So it can be hard to shift that. But things like I have to get 8 hours, or I'm gonna get fired, or I'm gonna be in really poor health, or I'm gonna get sick. Breaking up some of these myths can be really important, because then it reduces the anxiety, right? So remember the tiger and the stress. The anxiety's down, we're much better able to sleep, okay? And then reducing sleep effort. The harder, in the way that we live our lives, usually if you put in more effort, it works out better, right? So like if I prepared a little bit for this, it probably, hopefully it's okay, right? But with sleep, the more effort that you put in, the worse it gets. So if you're trying really hard, like I'm gonna sleep right now, no, you're not, right? You're not. And so sleep is more of an allowing process. You allow your brain to kind of bring you into sleep. And that, if you can approach it that way, that can be helpful. And then relaxation, imagery, and I'll talk, well, I think actually it's the next slide. Okay. So we talked a little bit about that hyperarousal piece. One of the best ways to address that is with relaxation. So are any of you, when you're health education stuff, or do you teach relaxation, or do you suggest it? Yeah? Okay, so really the most important thing is for it to be soothing to the patient. There isn't one way of doing it that's better than another necessarily. The patient just has to like it, and it has to be soothing to them. So some people really like imagery. They'll go to a beach or a forest, right? Some people like more of the body scan, where you'll pay attention, kind of from one end to the other in just a very relaxed kind of way. But it has to be individualized. And I learned this. I kind of knew it, right? But I was just telling people, well, look, do this, and it'll help reduce your arousal. And they'd come back to me and they'd say, okay, I tried that, and it just made me stressed, or I didn't like the recording, or I didn't like the woman's voice, or, so it's got to be individualized to the patient. Apps, there are lots of apps out there. I don't know that one is better than another, but I would go with the ones that are free, right? But here are some suggestions that I often will recommend. CBTI Coach was developed to be used with CBTI, and it has some audio recordings of relaxation. But the rest of these are just relaxation, guided relaxation. Yes? Yeah, they're free initially, and then you can pay. So CBTI Coach is free. The breathing app is free. Stress Free is free. Okay. Other questions about those? Okay. And then the other part with the hyperarousal is to modify your thoughts. So are you guys familiar with acceptance and commitment therapy at all? Have you heard of that? Okay. So part of what it involves is shifting your relationship with thoughts. So rather than hooking in, rather than believing your thoughts, you just see it as a thought, okay? You can put a thought on a cloud and let it drift by, or maybe on a train and let it drift by, or chug by. That can be helpful for sleep. Okay, so sleep hygiene. So I'm just going to run through this. Again, it's not a standalone treatment, but for some people it will benefit. So caffeine, I'll generally recommend that people eliminate caffeine after lunch, but given the half-life of about 6 hours, you really want to do at least 8 hours. Okay, so for someone going to bed at 10, that would look like no more caffeine after 2. Nicotine impacts sleep. Unfortunately, smoking also really does relax people. So there are lots of people out there that are smoking is the last thing they do before bed. And now they're vaping is the last thing they do before bed. So helping them understand that nicotine is a stimulant and does impact your sleep is helpful to people, especially kids, because everybody is vaping now. Alcohol, so you brought up alcohol, right? A bottle of wine. The thing about alcohol is it will put you to sleep, so lots of people fall into that trap. Well, I can't sleep, so I'm going to have a few cocktails, and I do fall asleep. But then a couple hours later, you're awake. And you're either wide awake or you're doing kind of this dozing in and out thing where you don't feel like you get very good sleep. So really, alcohol, maybe with dinner, but probably not after that, is going to be best for your sleep. Avoid giant meals, like the 4th meal. Remember that commercial, that Taco Bell commercial? Don't do that before bed, right? Small snacks can be helpful. There really isn't any food that's going to help you sleep, like any specific food. The research just doesn't bear it out. But if you have a little snack, that can feel good on the tummy, and that can be helpful. Okay. Short naps. I'm a believer in power naps. They're helpful for a lot of people and are a lot better than a cup of coffee at 1 p.m. or 12 p.m. or before, certainly 2 p.m. But having a short nap can be very refreshing, gives a great recharge. You just don't want to do it too late, and you don't want to sleep more than about 30 minutes. Okay? And then keep the lights dim in the evening. This is that circadian rhythm stuff. You don't want to have any alerting factors after about 8 p.m. if you're shooting for a bedtime of 11. So dim the lights. It's a peaceful time. Get some blue light blocking glasses if you're going to be on a screen. Those kind of things are helpful. Calming routine. For those of you that have smaller kids or teenagers or yourselves, bedtime can be stressful. Johnny, that is like the 5th drink of water that you needed. Go to bed, right? And then all of a sudden everybody's mad, everybody's upset, and we can't sleep when we're mad and upset. So having these really positive routines that happen as many nights as possible during the week are helpful for sleep. So for little kids, bath, maybe a little piece of cheese or something. And then a story. All of those kind of things can be built into a routine that will then actually follow them into adulthood because they'll know how to sleep and they'll know how to do it. Avoid chronic use of sleep medication. I work with so many people who were, they weren't sleeping, and so they got a sleep aid, and then 10 years later they're still on it. And they're afraid to be off of it. That happens just way more often than it should. So, they really are meant for short term, and there are other strategies that are equally effective and more effective in the long term, and that's what we're talking about. Okay? Exercise, really good for sleep, but not right before bed. Okay, so you want to give generally about 2 hours in between when you're done working out and when you're going to go to bed. And then, did I get it all? I think so. So questions on sleep hygiene. How familiar is everybody with all that stuff? Is that kind of stuff and is kind of in the, okay, good. All right, so here are some book recommendations. Yeah. Right, doesn't really work, yeah. No, the glasses work. So the glasses have good peer-reviewed research behind it that they actually do work.
But the actual blue light filter screen on
Yeah, the screens like on your iPhone and stuff, those just, at least in that study, it didn't show to impact anything. Okay. Other questions on the sleep? Yeah.
So is music okay? I mean, it's called helps you sleep. I'm just wondering if that's going to keep your mind.
Yeah, so music is I think more of a personal preference kind of thing. So we really, at least the research shows that we sleep better when it's quiet, right? But for some people, music is very soothing. And so if you can have a very low level music like through the night, that can be helpful. The one thing that you want to be careful of is if you have any white noise or if you have music, things like that, the brain when you're sleeping will register difference, right? So if you have music and then you don't, your brain is going to kind of register that. And for some people that are kind of light sleepers or register everything, that may wake you. Does that make sense? And that's where white noise can be helpful, is because it reduces that difference. So if you live on a busy street, but you've got white noise going on, the noise on the street isn't going to register to your brain quite as much. Okay? Other questions on that? Okay. Oh, yeah, sorry.
So what would you suggest to a person that is waking up and not able to fall back asleep? So it's like 1, 2, 3 in the morning. Should they get out of bed or just stay there and keep stressing about not sleeping?
Yeah.
What should they do?
So I would ask them, well, how long are you spending in bed? Okay, so if they're going to bed at like 9 and they're not getting up until 7, right? That's 10 hours of sleep opportunity. The chances of them needing 10 hours sleep is really low, right? So first I would say, well, why don't you reduce your sleep in, your time in bed some, okay? And if they do that and they're still waking up, a lot and not getting back to sleep, what I usually will tell people is if it's been about 20 minutes, you probably ought to get up. So rather than being frustrated in bed that you're not sleeping, go be frustrated on the couch that you're not sleeping. And then when you feel sleepy, go back to bed, okay? Most people don't have to do that very long before they can actually do better with their sleep, okay? So that's the general.
Turn on a screen or something.
Yeah, for sure, don't turn on a screen, because that would chase the melatonin out, and then the chances of getting back to sleep are really small.
And in that same situation, if the person's really tired and is finding themselves tired during the day, taking a nap will still create the problem, right?
It will, right? So trying to power through. So getting light exposure, if you're starting to feel sleepy, go outside, get some bright light exposure, move around, whatever you can do to power through the day, and that should help your sleep at night, especially if you're not too worried about it. Yeah.
So as you get older, is it quite normal to have problems with sleep?
Yes, it is. And there are lots of reasons for it, right? Some can be medication side effects. There are usually more aches and pains. Everything is kind of relaxing, so sleep apnea is more common. But there's also really good sleepers still, as we get older. So you just want to make sure that you're doing probably more of this as the recommendations are. Does that make sense? And then making sure that light exposure is good. A lot of people who will go to who are older, 80, right? They'll go to assisted living programs, and the light that they get is so little that their circadian rhythm really is a mess. So doing all the things that help sleep will also help as we age. And actually, after about age 55 or 60, our melatonin system doesn't work quite as well. So a little bit of supplemental melatonin can be more helpful as we get older. Okay. Other questions with that? Okay, so these are some book recommendations. These are books I recommend. The first one on the list, Goodnight Mind, is the one that I usually will have patients read. No More Sleepless Nights is a good one, but it's older, and it's longer, and a little harder to get through, but it's got really good, solid information. And then these are some for kids. Okay, that No War Way, or whatever it's called, a teen could read that. It wouldn't just be a parent reading it and telling them, okay? And then finally, here's some electronic resources. So for patients who can't find access to a CBTI provider, they can do it. They can do the treatment online, and the research is great. It's almost as effective, and in some studies has been shown to be equally effective. Okay, and then those are some apps that are helpful. Just a word about sleep trackers like Fitbits, that kind of stuff. They aren't quite there yet. They can provide some information, but they usually either overestimate or underestimate sleep. Okay, and I think my time is up. But do you have questions, other questions that we didn't get to? I'm going to hang around for a little while, so.
What is your opinion on like devices, like having that close to your bed when you go to sleep? Like my husband falls asleep with his iPad and phone like right next to him, like on the pillow usually.
Yeah.
So listen to that, which I drives me crazy.
Does it? Yeah. So it's a really good question, and there is, so kind of on the fringe of things, right, is this electromagnetic stuff, that people are concerned about, and I just don't know enough about it. But I think because oftentimes our phones will go off during the night, or there's noise, or there's light shifts, or whatever. It's better for most people if they're in the kitchen or somewhere else. But I don't know that there's any evidence that says, well, if you have your phone and it's on airplane mode and it's not gonna make any noise, that it would make your sleep worse. So, okay.
What about snoozing your alarm?
Yeah, great. No, it's a good question, and I should have talked a little bit about that. So most people have some sleep inertia, right? So when the alarm goes off, most people don't jump out of bed, like bring it on, right? It takes a little time. So for some people, snoozing can be helpful. The thing to remember is that if you're snoozing for an hour, right, you probably would have been better off sleeping an extra 45 minutes and then snoozing for 15, okay? So I guess snoozing for maybe 10 or 15 minutes, because that kind of leads to a more gradual wake up. It's not so startling to the body, and you usually have a better day. But don't snooze for, an hour or two. Other questions? Oh, sorry.
No, I just have a question about valerian root. I'm
Yeah.
an awful sleeper.
Yeah.
I go to bed, no books, anything in my room. I'll get to sleep. I sleep 15 minutes,
Yeah.
no lie, and I'm awake.
Oh, yeah, okay.
I go get in the tub, so
Yeah.
I'm not in bed.
Right.
I sit in the tub for hours. I go back to bed, and I've seen some stuff. Take it, don't take it.
Right.
I'm just wondering about that, and can you take it long term? And
Yeah.
does it even work?
Right, so it's a great question, and the peer-reviewed research, there are some studies that suggest that valerian can be helpful, especially if you've got some kind of cognitive arousal, or you're a little anxious, that kind of stuff. Valerian can be helpful because it acts, they think anyway, on GABA. There haven't been shown to be long-term side effects. Okay, so if you were going to take valerian root as opposed to maybe like kava, valerian would be better because kava has been shown to be bad for your liver. So I think the main thing is to be cautious, but there are some studies that say, it could be helpful for some. Okay, same with like acupuncture. There are lots of other strategies out there that have some support, and then other studies that don't support it. So kind of jury's still out. But
So why do I wake up 15 minutes later?
let's talk about that after. Okay, I'd be happy to do that with you. Yeah.
Like at what age would you say it's okay to do melatonin? Like, because I had a friend who was like, you should give it to a baby. I'm like, I
Right.
don't think that's a good idea.
Yeah, so lots of people ask that question, right? And so far the studies haven't indicated that there's any harm in giving it even to kids, even for like 3 years. They've done some studies with ADHD kids. But I kind of lean on the cautious side, right? So I would just hold off as much as you can and do some of these other things, like get light exposure, because that's going to strengthen that rhythm more than a little bit of melatonin will. Okay, and when when you're in your 20s and your 30s, your melatonin system is working the best it's ever going to work. So those kids really don't need it. Those people don't really need it unless they have a delayed sleep phase, and then just that little dose is what's most effective. Okay. Okay, yeah. Oh, no, okay. Other questions? Okay, well, thanks, everybody.